Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, here today with Jessica O'Day, who's responsible for our youth and young adults program, which is, I guess we do a lot of different things within that program. We do some short-term kind of mental health counseling with kids. We also do, drug or alcohol addiction treatment with kids, but also a big part of that is prevention.
Yes.
And I know that we have a big event coming up for prevention in the month of May.
Yes, there's a National Prevention Week. It's May 12th through May 18th, and it's a national annual observance that the goal is to promote awareness to the public about not only substance abuse issues, but also mental health and just wellness and taking care of yourself, the mind-body connection. And the goal is to get individuals, organizations, coalitions, community members working together and understanding those two issues and kind of supporting, our efforts and supporting people across the lifespan, not only young people, but into adulthood too.
Well, and I think that's one of the things that we don't spend enough time on, because I think we're trying so hard to provide treatment for individuals for all those issues. But at some point, we really have to start putting more energy and invest more dollars into prevention. And I think that just continues to be a struggle from a funding perspective.
Absolutely. A lot of schools and communities don't have the funding to provide for a service provider to come into their school, to the elementary schools, to provide that preventative type work. So I think we're seeing agencies and places become very creative in trying how you can reach the community and get the community to kind of support and buy into that, so that then they will help with those dollars to be able to provide the services.
Yeah, and unfortunately, from a dollar's perspective also, it's much more expensive to treat people than it is to help provide the prevention services.
Yes, prevention is much cheaper, much more cost effective if we do do those things earlier on for someone versus when they do get into the system or into treatment, and it's more chronic and long term. So
now, when you work with kids, I think the other issue about prevention is kind of hard to measure. But I think the hope is, right, that maybe something that you talk to a child about now, they might not necessarily be able to relate that, but there might come an instant somewhere down the line that all of a sudden, boy, I remember what Miss Jessica said to me.
Yes, I had a supervisor a couple years ago that used to always say that to me. I would get a little frustrated if I felt like they weren't getting it or they weren't understanding it. And she said, "You're planting seeds. You might not see it kind of happen today, but years down the road, they'll remember what you said, and those seeds will be fertilized and things will happen for them." And that does happen a lot. I've run across a lot of kids that come up.
Well, and I think what I see too in talking to some of the kids that you and your team work with is not only does that happen, but I think the other thing happens is they talk to other kids, and they're actually spreading those seeds through other kids too, and so there might be another child that we haven't even had direct contact with who I think is going to be affected by some of the work that we do on the prevention side.
Yes, you're absolutely right. Our prevention program that we have is very much a peer mentoring and peer leadership model, where they talk to each other and they empower each other and they spread the word. And there's actually a rally on May 2nd in Columbus that is called We Are the Majority, and it's a second annual event, and it's youth from all over the state of Ohio saying they're the majority that are choosing to be drug-free and make positive choices. And they rally and they go to the State House, and they're empowering each other, and they're meeting each other and networking with each other, and they spread that word to go back to their school and spread it to the other students that are there.
Very nice, because I know that what happens, what we observe a lot of times is that we're starting to talk about issues, not just drug and alcohol, but other issues that kids are facing, like dealing with self-esteem issues, dealing with bullying, dealing with all those different challenges that kids are facing today, and how much social media has affected all those problems.
Absolutely.
And so I think that we need to continue to invest more and more in prevention, and you and your team do a great job in doing that. So we'll look forward to, remember to celebrate National Prevention Week, May 12th through 18th. Thanks, Jess.
Thank you.